Philippines comprises more than 7,100 islands. This country offers a beautiful nature, but besides the beauty of the Philippines, it also has its downsides. Poverty in healthcare remains a big issue and a challenge. Around 60 to 70% of the 100 million inhabitants is living below the poverty line. There's a big gap between the poor and the rich, and this gap is only increasing. Children in the Philippines are often suffering because of poverty. In many cases, parents have less or no money for the medical expenses of their children. There is a national health insurance program called PhilHealth, but not everybody is enrolled and many costs are not covered within this insurance. Fortunately, there are some hospitals in the Philippines who make sure that also these poor children can get the care they need through donations and governmental support. One of these hospitals is the National Children's Hospital in Manila.
The National Children's Hospital is a hospital under the Department of Health. So it is a public hospital. That's why we take care of the underprivileged children. It has served a lot of children with different kinds of diseases, from head to foot, so from the brain to the pulmonary and to the whole part of the body, so any types of diseases. Still, we have a lot of infectious diseases that we have not yet controlled, but there is also a rising problems of chronic diseases like the cancers, the leukemias in children, and also some old diseases like tuberculosis in the Philippines.
Our hospital is a specialized tertiary hospital for children. So we cater here the critical patients. So if a secondary hospital cannot treat that patient, cannot manage that patient, they transfer here in our hospital.
Our vision for the future is to be able to help every child who is sick, and also prevent them from getting sick as much as possible. That's why we have also assigned staff in the hospital so that we can teach these mothers on how to prevent diseases.
My biggest motivation would still be because I like serving people. I like serving children. I want them to get well. And you know, when you were able to send a patient home, it gives you this kind of fulfillment. That parang you became happy by making other people happy. And when you send a child well, the family, the parents, the whole of the family gets happy as well. So parang it affects the child's health, affects the family as well.
Good.
To support the children and the family during the whole process, Coordinator Maria Sanchez is helping them mentally.
We don't only focus to a child, but to the whole family, so that the whole family can understand what happened to that child. I want to be honest with them. I don't want to tell just a fantasy or whatever, that the procedure is so plain and it's not easy for them to. But I ask them to do it because like an exam, there's only a selection A, no B or no C. I love my job because I love them all, especially the kids and the whole family, and I want to help them for not just for the sickness or just to mold again the family as a whole. That's the only thing that I can help the kids for no matter what.
The hospital as of now is undergoing construction, the budget being given by the government. However, the equipment for the operating room are really very expensive. We need the operating room lights, the operating tables, the anesthesia machine, and several other equipment there. Also in the intensive care unit, where you really need some very the technology that can save the lives of these children.
Our patients here are basically, we cater for indigent patients. When you say indigent, they are charity patients, so they don't really have a lot of, finances for them to really get well. So we want others to sponsor their management, their treatment, so they can go home as early as possible.